All right, time now to talk about something pretty serious here. This is Diabetes Awareness Month going on. We've got Dr. Tony Tsai here right now to tell us what's happening with, of course, the Retinal Consultants Medical Group. Good to see you.
Yeah, thank you. Thank you for having me.
All right, so let's get right into this. What do you want people to know about Diabetes Awareness Month?
Well, as a retina specialist, I think that most people know that diabetes is an increasing problem, not just in America, but in the world. And high blood sugars over long periods of time can affect a lot of the organs in our body. People know about the heart, they know about the kidneys, they know about the peripheral neuropathy. As a retina specialist, I'm focused on the eye, and specifically on the retina tissue, which is the light-sensitive tissue on the inside of the eye that gathers the images and sends the messages to the brain.
Yeah.
High sugars over time cause damage to the retina, and we call that diabetic retinopathy. As it turns out, over half the people who have diabetes end up having some form of diabetic retinopathy.
Wow, and can this, I know this is the tough question here, can this lead to blindness?
Absolutely it can,
Okay.
and that's a sad thing, but it's important to know not everybody with diabetic retinopathy ends up with severe retinopathy damage and blindness, but if early signs, early features don't get detected and appropriately managed, it certainly can result in blindness. As a matter of fact, diabetic retinopathy is the leading cause of irreversible blindness in working age adults in America.
Okay, so you said, that's interesting. You said that early detection. How do we know if there's something that's happening? How do we know that when this could be going in my direction? Or is it too late at that point?
Yeah, many people with diabetic retinopathy don't have any symptoms. And so that's important to realize that at first, many people in the early stages don't have any symptoms. It's important to manage the diabetes with their primary care doctors, with their endocrinologists. And if that's done well, many people don't develop the kinds of damage that leads to blindness. The other kind of fork in that is making sure people get regular eye exams. Everybody who has diabetes should get at least an annual eye exam with a careful evaluation of the retina. People with early signs of disease may need more frequent exams so that we can intervene at a time that prevents them from having severe vision loss.
All right, so the symptoms though, can you tell us a little bit of what some of those are? Because sometimes we don't really know if they're coming, but what are some of the symptoms?
Sure, as I said before, again, it's important to realize that people don't always have symptoms, and if we don't recognize it early, they can progress to severe damage to the point where it's a sad thing as retina specialists when we see people, they don't come in and we don't see them until they develop late disease. And sometimes even our best treatments at that point are really just trying to keep further vision loss from happening.
Got it.
Now, having said that, diabetic damage occurs to the small blood vessels in the retina, and the different ways that it damages the blood vessel in the retina lead to different kinds of symptoms. So one of the ways that diabetes causes damage to the small blood vessels is they become leaky. So I explain this to patients like a garden hose that starts becoming like a soaker hose.
Got it.
And fluid starts leaking out of those blood vessels, and if that happens in the center part of the vision, they start getting these fuzzy spots, blurry spots in their vision. Another way that diabetes causes damage is it prunes those small blood vessels off. So if you imagine like a tree, you start losing the small branches and you're just left with the big branches and trunks. And that leaves areas of the retina without enough blood flow, and they don't function well. And your body can be stimulated if that advances far enough to start forming new blood vessels. It sounds like a good idea, right? You're forming new blood vessels to replace damaged ones. Unfortunately, we're not really designed to grow new blood vessels. And these new blood vessels, they're not normal, and they start to leak and bleed into the cavity of the eye. And that can cause floaters and swirls, almost like a lava lamp in the vision.
Wow.
In the most severe stages, some of these abnormal blood vessels can actually fill the blood on fill the eye internally with blood, or even cause traction that detaches the retina, requiring surgeries.
Got it. We got maybe 10 seconds left for this last one. Any sort of, how do you treat that?
Well, there are lots of different ways to treat diabetic retinopathy,
but
we, since the 70s and 80s, we've been doing laser photocoagulation. In the last couple of decades, we've really advanced the care of retinal disease by injecting medicines regularly into the eye that can sometimes actually reverse some of the damage. In the most severe cases, sometimes we have to take people to the operating room. Now, our treatments are pretty good, but we're not resting on that. We're trying to do research. Our group, along with universities and other groups across the country, are doing research to try to find better treatments for tomorrow. And thanks to the hard work of researchers and generous volunteer patients who participate in clinical trials, we expect to have better treatments in the future.
I hope so. I love that. All right, thanks for joining us.
All right, thank
I really
you.
appreciate it. Coming in, of course, on Diabetes Awareness Month. We'll throw up a little bit of information. There it is right there. retinalmd.com. You can check it out and stay safe out there.